Welcome to Philly Fortune Talks with your host, Jake Penny, where the city's brightest minds share the secrets behind their success. Are you ready to be inspired?
Are you ready to discover how one social service professional is transforming lives through innovative resource connections? Meet Katrina Pratt Roebuck, founder and CEO of Uplift Me. With 25 years of experience in nonprofit and government sectors, Katrina has dedicated her career to serving low income and vulnerable populations. Uplift Me is a national resource hub that provides real time information on resources and events addressing the social detriments of health. By making this information accessible, Uplift Me connects people to the services they need to improve health quality and literacy. Katrina's visionary leadership extends to Uplift Me Institute and Uplift Me Executive Coaching, where social service professionals can enhance their skills, advance their careers, and cultivate well being. Additionally, through the Community Connection series, Uplift Me highlights the impactful work of public and nonprofit organizations, fostering collaboration and innovation. Katrina, it's a pleasure to have you on Philly Fortune Talks.
Thank you so much for having me.
So, your career spans 25 years in social services. Can you share what initially motivated you to work in this field?
Sure. So I was an undergrad psychology major, and I was just always really interested in behavior and well-being, and thought that I'd want to be a marriage and family therapist at one point. And so I completed my undergraduate degree at Howard University, and I was actually registered to be a part of a marriage and family therapy program. And I was a mental health case manager for a year and got burned out. And I realized that direct services is very, very hard. And although I love that work, that was something for me that I wasn't able to do sustainably. So I decided to think about the programmatic end of social services. So I still knew that I wanted to do work to help vulnerable populations, and I knew that I wanted to do work around behaviors and understanding people's behaviors. And so I ended up getting a graduate degree in business, and then working in a variety of different organizations, nonprofit, and government, using that degree in the social services field.
So, tell us, tell me, the listeners, what is Uplift Me and, what's your vision for the organization?
Sure. So Uplift Me really has become a cultivation of my life's work. Starting off as a mental health case manager, I knew that it was hard to find resources for folks. And as a case manager, I was always looking for the right resources that could help someone in the time in which I was serving them. And so from my very early career, I knew that I wanted to do something that helped to get information to people more easily. And I think that over time, as we've had social media and the internet sort of expand to be accessible for everyone, I saw opportunities to provide information on social service resource events on a platform. And I knew that if I could get enough people to know that there is a centralized location for resource events, that could be something that's really helpful. And so Uplift Me is really about providing a centralized platform that anyone can use to find resources that they might need. And one of the things that I really wanted to be intentional about is making sure that it was easy to search Uplift Me. So a person can come on to Uplift Me and search one or two clicks and find the information that they need. I also wanted to make sure that there were no barriers to the resource. And so everything that is posted on Uplift Me is free. And it's free for people to find information, and it's also free for people to post information. And so I wanted to really make something that was barrier free, that had as least a navigation as possible, and really provided people with valuable information on resources that they can obtain today if they wanted to.
Yeah, that's really amazing. Uplift Me aims to improve health equity, providing real-time information on resources.
Mhm.
So, what, key strategies have been essential in achieving this goal?
So I think one is just making people aware of all the resources available is really something that is a game changer. To know that you can find out any hiring event happening across the city, any food giveaway happening, any community baby shower happening. It really allows for people who might need these resources and may not be privy to certain types of services where they would naturally find out about the resources, right? So it really helps in terms of democratizing information, making it all available to everyone who accesses the website. And so, what I wanted to really make sure of is that by sharing this information, people not only could address different things like social determinants of health, but it would also provide information that could increase their health literacy. And so, health equity is, as we know, related to health related social needs, also known as the social determinants of health. And it's also about understanding your health. And so, when I talk about health literacy, I'm talking about information on resource events that might be resources where there are vaccines provided, information given to folks that might be pre-diabetic or have hypertension. There's lots of health resource fairs, community resource fairs, and different types of events that provide people with a plethora of opportunities for information and resources. So I believe that by providing that information in a centralized place that's easy for people to access increases health equity, and it also increases health literacy for those that might have health challenges that need to be addressed.
So at Uplift Me, behind any organization is a true power team, right? Um, so when building your team at Uplift Me, what qualities do you prioritize and why?
Sure. So I'm fortunate to work with this amazing developer out of Seattle, who is a woman that works with a lot of nonprofits, and it is her mission to make their information and services available to the public. I also, because I've worked in social services for 25 years, have a number of colleagues that are both working and retired, in which I have gotten feedback from and who are very supportive of the website with me. So a lot of my believe it or not, retired colleagues have really provided time into supporting this work and really thinking about strategically how to make the resources available and just thinking about the user friendliness of the site, thinking about what types of categories of information people need. So I've really had the benefit and the blessing of having people who are very well versed in various fields within social services, as well as a great developer who have supported this work.
So you are very focused on connecting people to services, primarily health equity. Can you talk about maybe the technological platforms and share an example of how your innovative approach has made a difference in the communities you work in?
Sure. So once a person logs on to Uplift Me, and so when I say log on, I just mean visit the site. It does not have a requirement for a username or password, so it's available to everyone. So you can visit the site and find information. And so, folks, in terms of the technological platform, they can just scroll through the information that they are looking for based on city and state or on the resource type. So
Mm.
if you are in Philadelphia, you can find all of the resource events happening in Philadelphia. But if you are interested in jobs, as an example, you can put in the city, Philadelphia, and then you can also search for jobs. So those are the two filter options. And that's very intentional. I didn't want to have a number of filters that would require people to navigate and to know what to ask. And sometimes it's really about people not even knowing what they don't know. And
Mhm.
so when you have the opportunity to see everything that's available in a sort of broader category, that opens up the opportunities and the possibilities for what you'll find. So that's what I have done in terms of designing the site in a way in which it gives enough filtering to be specific enough for the issue that you're trying to address, but open enough so that if you don't know the right questions to ask, you can still get to the information that you want. In terms of how it impacts the community, I post a lot of community resource fairs, as I had mentioned earlier, health fairs. And so people have told me that they have found resources from some of the events that they've found on Uplift Me. So that makes me very proud. And it makes me proud because I know that a lot of times it's a chance that people will find information. So I, as an example, will receive a lot of information that I put on the site, but not everyone is on the same listservs that I'm on.
Mhm.
Not everyone that sends information is sending it directly to case managers who then see people and do direct services. And then certainly the general public are not generally on listservs of social service events like I or other social service professionals are on. And so really doing a centralized way in which to streamline accessing that information allows for folks who may not be connected to information to find it here. So you don't have to be on a listserv. You don't have to know a certain case manager or a certain organization to find out what's happening. It's all being made available. And so by doing that, people have said to me that they found more information than they knew existed before because they weren't in those information loops, if you will. So that's how it's impacted folks so far. And it really fills me just when someone says, I found something that I didn't know existed.
Yeah, just the user friendliness in itself is huge because I know for me, trying to use some platforms and it's
Mhm.
daunting, it's not friendly, and it's like you get overwhelmed and you just don't
Right.
know where to go. And
That's
that's super important for healthcare, social services, everything, because most of these, you're looking for a certain thing that you need, and you
right.
want them to be able to obtain that thing and not get scared away because of the usability is tough.
That's right. That's right. And to your point about it being daunting, it is. And it can be daunting for folks like me who are social service professionals who have been around a long enough time to have used a number of different systems and worked with lots of nonprofits. And I can tell you that it can feel overwhelming to me sometimes. And so, really, in terms of the design, I think when you're thinking about, from a social service perspective, dealing with someone in crisis, right? You are in survival mode and you are not able to, that person is in survival mode and they're not able to necessarily think through 10 different options to know what questions to ask, right? So, in thinking about if you are a person who is in crisis, what would be the best thing for you? Something that's easy to navigate and something that's free, something that can give you information right away that can handle the issue that you have, if not that day, close to immediately as possible. And so I think that for folks who are in crisis, it certainly is daunting. But I'll also say, as a social service professional, I have found it to be often hard to navigate services as well. So I was hoping that this would be a tool that both the general public could use, but also social service professionals can use to help the people that are on their caseloads. That's how I started out. And so when I designed this, I started out with myself being a user in mind and also helping other people.
Yeah, that's super important. You were the first customer client. You built it around your needs and necessities, and most likely you were thinking the same thing that many others were thinking. So you solved that. You brought a solution to the market. Um, what upcoming trends or opportunities for Uplift Me, yourself, services are you most excited about, and how are you preparing for them?
Yeah, so thank you for asking that question. So I'm really excited that on a local, state, and federal level, it has been understood that social determinants of health are very important.
Hmm.
And so oftentimes, and I've worked in behavioral health, I've worked in homeless services, in anti-poverty work. And so oftentimes we are dealing with people in different silos of issues and not providing people resources that can support their whole selves. So, if you are facing food insecurity, it might be challenging for you to get to certain types of appointments because that might not be the priority for you. If you are homeless, you might not be able to have certain types of medications you need because you don't have a refrigerator. And so, to think about the whole person and all of the resources they need, all of the needs that they be met, all the basic needs that are important for anyone to be well is really exciting to me that now that is a recognition in the field and that is something that is gaining financial support for. So on the federal level, I'm really pleased that the Health and Human Services government agency, as well as the Centers for Disease Control, are all trying to think about the whole person and how to make the whole person healthy. I joke with a lot of colleagues and say, community health workers is a newer term, and addressing social determinants of health is a newer term. But I've been a community health worker for 25 years. No matter what title I've been in the business of helping people get information to make them healthy. And so I know a lot of my colleagues feel the same way. So I'm really excited that folks recognize that to give someone a service to help them be healthy, it's also about their economic stability, their housing stability, their food security, in order to make sure that every need is met to allow them best opportunity to be well. And so that's what's really exciting to me. And I think that that's going to really, really help not only individuals, but families and communities to be healthier. I think that it will take people out of crisis mode. It'll do a lot in the space of prevention. And I think overall, that's what we want, right? We want to prevent crises from happening. We want to prevent poor outcomes from happening. So I'm really excited that there is an emphasis and that it is recognized as important to take care of the whole person.
Yeah, absolutely. And it's important to be proactive and not necessarily reactive, right? We want to combat these things up front, not on the back end.
That's right.
Um,
Right.
so Katrina, everybody, especially organizations, it's important to have goals, right? So what are your long-term goals for Uplift Me and how do you plan to achieve them?
Sure. So some of my immediate goals are to make the site available and recognizable across the city of Philadelphia. So I really want to get the word out so that people are using the site. And so it's free again for folks to find information on the site, but it's also free for organizations to post information on the site. And so there are a number of wonderful community-based organizations and churches and individuals that do a lot of good work that many people may not know about. And so what happens is those folks can send flyers to my organization, and we vet every flyer that goes on the website. And then we'll post it. And so my immediate goals are to get more recognition around this as a resource for both people who need, access to different services, as well as those social service professionals. And then also to invite organizations to post information on the website. So those are sort of the immediate goals that I have. And then it's a website that spans the nation. So I have over 27 cities listed in the website. And so I see this as a national resource hub. And so my term goals are to make this information available across the country. And I'd love for people, again, to see this as a free resource that is going to provide immediate, helpful, useful information to them and their households. So if I can do that, I will have succeeded in my mission. And I will feel really good about knowing that I've made it easier for someone to get the help that they need.
That's amazing. Yeah, that's kingdom work right there, as they call it.
Thank you.
For aspiring social service professionals in your industry and other industries as well, looking to make a significant impact. If you had to give them one piece of advice, what would you give them?
Well, I think that I would first off say to whatever it is that you're working on, a lot of times I see people get bogged down around issues because of their complexity. And I see a lot of bureaucracy happens because people are bogged down in complexity. And so, what I often say to the people that I work with, what's the long-term ideal solution? We want to think about that. But what is the today solution? If that person comes to you hungry today, what is the answer? How do you get that person help? If a family comes to you today with nowhere to sleep tonight, what is the answer? How do you find help? Of course, down the road, there needs to be more affordable housing and there needs to be more resources around food that are accessible to people. But those are longer term. what is the answer if you had to solve a problem today? And I want to say that very
Mm.
intentionally because I think that it is often easy to think about a problem and say, okay, well, we'll need about 6 months to build this thing. We'll need to RFP it. We need to find some resources for it. And you're talking about solutions that might be 6 months, a year, or 2 years down the road, but you have people suffering today. And so I would invite anyone to think about, yes, what's the long-term ideal solution if we had everything we needed to have, but what is the answer and what can we do right now today to help the person that needs our services right now? And I think if you can have that nimbleness and flexibility in your thinking, you also have a lot of innovation, a lot of creativity, and then you also have this drive to be solutions oriented. That's what I would offer that folks think about.
Yeah, it's super important to have the now in mind because for, like you said, it could be 6 months, a year down the line to where the thing that we were working on comes to fruition and then it's helping people. But that could be too late for somebody
That's right.
in need today.
That's right.
Um, and I had the pleasure of talking with someone on the board at the Urban League of Philadelphia the other day, and they were doing the affordable housing thing and helping people get homes and everything like that. And that's amazing work that they're doing.
Mhm.
Like you said, also, it's like what is today's issue that needs to be solved and needs to be solved now? How can we proactively go forth and help those people in need that need, technically quick response?
Yeah, absolutely. Absolutely. And I think that because I've been in roles that are both emergency services oriented, so I think about what's happening today, and I've been in roles in which I was planning and in the development of, creating a program. I've had to think in both ways simultaneously at times.
Mm.
But the reason that I say that is because it's not about just being it is about being immediate, but it's not just about being immediate. It's also about being innovative and solutions oriented. So when you are thinking about what you can do today, right, there's strategy behind that too. And sometimes I think I've either seen people sort of get bogged down in complexity or overwhelmed about the largeness of the issue. And so I would say that when you have a mindset to think about what the today answer is and what the long term answer is, it allows you to bring forth solutions that you might not have thought about before. So that's really the thinking that I think is important. And it's not a either or, it's a both and.
Yeah, that's super important. And it can be tough to play both sides at times. You have to be a forward thinker and a current thinker, which
Mhm.
mostly everybody's used to preparing for the future and
Mhm.
not acting under pressure and doing now.
Right.
So Katrina, we time flies when we're having fun.
Mhm.
But as we wrap things up here, for listeners who want to connect with you, learn more about your work, get involved with Uplift Me, and just giving back in any way they possibly can, where's the best place for them to go to learn more about you and how they can help the initiative?
Well, thank you very much for asking that. And so people can visit the website at www.upliftme, which is UPLIFME.com. So it's uplift me without a T, .com. They can go on and they can find the events that are happening across the country. They can also go on the media tab and look at all of the amazing interviews of the folks that I've interviewed along the way. And then they'll find other resources that could be helpful to them or the people that they serve. And if folks want to reach out to me, you can reach out to me at info@upliftme.com. And I'd love to hear from anyone who would like to partner in this work or to support this work.
Awesome, Katrina. Well, it was a pleasure having you on Philly Fortune Talks.
Thank you so much for having me. I really appreciate it.
Thank you.
Thanks for tuning in to Philly Fortune Talks with Jake Penny. Inspired to share your success story? Visit phillyfortunetalks.com/guest and let's inspire together.